Imagine being sick but not having money to see a doctor. That's the Canada before Medicare, and here's how ordinary people fought to change it. Okay, quick throwback. Imagine being Canadian in the 1940s or 50s. If you got sick or broke a bone, you weren't just worried about your health. You were worried about the bill, families went into debt for basic care. Some just didn't go to the doctor at all because they could not afford it. Who fought against it? And guess what? The people fighting the hardest against Medicare were the ones making money off private healthcare. For instance, insurance companies, the pharmaceutical industries, even the Canadian and American medical associations. Their goal: protect profit and avoid accountability. Tommy Douglas is known as the father of public Medicare in Canada because he introduced the first public hospital insurance plan and then the first medical insurance plan as Premier of Saskatchewan. All other provinces followed suit.
When you go back to your constituency and you run into somebody who says it's a good idea for you soft-hearted humanitarians, but we can't afford it, let me give you a simple statistic which you can put down on a piece of paper and carry in your head. And that is that our friends in the United States are spending 9% of their gross national product. And they get a higher per capita gross national product than we do. They spend 9% of their gross national product on health care, and 34 million of their people have no health care coverage. And in Canada, we spend 7% of our gross national product, and every man, woman, and child in Canada is covered under Medicare.
So, who fought for Medicare? Ordinary people, farmers, union, faith groups, and community health centers. Folks who believed healthcare shouldn't depend on how much money you had. World War II really showed how bad it was. A national study found that 44% of young men were rejected from military services because of poor health. Nearly half the country's youth weren't healthy enough to serve. That shocked the country and helped propel forward the fight for public health insurance for all. So Canada started building, first hospital insurance, then medical insurance, and by the 1960s, Medicare went nationwide, and we had allies like Justice Emmett Hall, who pushed for fairness and accessibility through the Royal Commission. Here's a key part. Justice Emmett Hall led a Royal Commission that said it clearly: healthcare is a right, not a privilege. His recommendations helped turn provincial programs into a nationwide system. Justice Emmett Hall said, "As a society, we are aware that the trauma of illness, the pain of surgery, the slow decline to death are burdens enough for the human being to bear without the added burden of medical or hospital bills, penalizing the patient at the moment of vulnerability." The Canadian people determined that they should band together to pay medical bills and hospital bills when they are well and income earning. Health services are a fundamental need, like education, which Canadians could meet collectively and pay through taxes. Starting in the 1990s, governments cut hospital budgets, closed wards, and newspapers screamed about waitlist enclosures. And when the public system is strained, private clinics creep in, making healthcare less equal. So, yeah, Medicare didn't just appear out of nowhere. It's a result of decades of ordinary people fighting for each other. The same question is here today. Will we keep healthcare a right for everyone, or let it slide into a system where only those with money can get care?